السلام عليكم ورحمة الله تعالى وبركاته. Esophagus. Esophagus, as you know, the gastrointestinal tract consists of oral cavity, pharynx, esophagus, stomach, small intestine, and large intestine. So, esophagus is a part of gastrointestinal tract, extend from the pharynx to the stomach. So, is a muscular tube about 25 centimeters in length. It is the narrowest part of digestive tract. This muscular tube responsible for convey the food from the pharynx to the stomach. It has three parts. Cervical part that located in the neck. Thoracic part located in the posterior mediastinum. Esophageal and abdominal part that enters the abdomen cavity and joins the stomach. Okay? So, as we mentioned, the esophagus begins from the end of the pharynx. So, it starts in the neck, opposite the 6 cervical vertebra, from the termination of the pharynx. Then descend in front of the vertebral column through the superior and posterior mediastinum. Then it passes through the diaphragm and joins the stomach. This is esophagus. It begins in the neck and then passes through the superior and posterior mediastinum in front of the vertebral column. Then it passes through the esophageal hiatus in the diaphragm to join the stomach. This esophagus has 3 constrictors. When you use enema, you can see 3 constrictions. The first one located at the beginning, about 6 inches from the incisor teeth. The second one and the third one located in the thorax, where it crosses by aortic arch and left bronchus. The last one located at the diaphragm. So it has 3 constrictions, one at the beginning, the last one when it transfers the diaphragm, and the middle where it crosses by the arch of aorta and bronchus. Blood supply of the esophagus. The cervical part of esophagus receives its branch from the inferior thyroid artery, while the thoracic part receives the arterial supply from the descending aorta, while the abdominal part from the left gastric. This is the inferior thyroid artery supplies the cervical part, and descending aorta supplies the abdominal part, and left gastric and inferior phrenic supplies the abdominal part. The venous drain. The upper third drain into inferior thyroid vein. The middle third drain into esophagus vein. The lower third drain into left gastric vein. The lower third drain into left gastric vein. The middle third drain here into esophagus vein. The upper third drain into inferior thyroid vein. Nerve supply. The upper third supplied by recurrent laryngeal nerve, while the lower and middle part receive its innervation from the vagus nerve. So the vagus nerve supplies the middle and lower third, and the upper third also from the vagus nerve through the recurrent laryngeal nerve.